So pretty frequently I get the questions of, well, this is covered overseas, why isn't it covered here? And I'm here to talk a little bit about it. If you didn't already know, my name is Chris, and I've been with Aetna Medicare and CVS Health for the last 6.5 years in their Medicare Advantage and Medicaid services. And everything I say here is my own opinion, my own research, and my own information that I'm just looking to pass to everybody, as many people as I can. But without further ado, let's talk about it. So there are a lot of procedures that are offered in the European Union, offered in Japan, offered in Australia, and many other countries, and are approved by their board of approvals for medical procedures. But here, the US has its own board of medical procedures, like the Food and Drug Administration, which I don't work for, so I can't speak on their behalf. But after it's approved by them, then it has to be approved by Medicare. And that usually requires several years of utilizing that procedure and proven effectiveness. A lot of times when I'm looking at information, they're looking somewhere between 10 and 15 years of proven effectiveness before it's even eligible to be covered by Medicare as a whole. Now, there are times where it's forced through and able to be approved earlier before that 10 to 15 year mark, but that's its own separate scenario, and usually it's something that doesn't have the ability to be treated by anything else. So this is just like a last ditch effort. But typically, after it's covered, then it will be allowed to be covered by your Medicare Advantage and Medicaid plans. So, with that being said, prior to that approval from Medicare, if your provider called us and said, hey, I want to put in a pre-certification for this service, and that service has not already gone through all of the appropriate steps, we'll tell the provider it's denied, it's not covered, period. There's no amount of pre-certifications that can be put in or appeals that can be put in to force that pre-certification coverage or coverage in general, just because it's not approved by Medicare. And at the end of the day, we still have to listen to the federal level and not just make independent choices. So, if you found any useful information in this video, go ahead, like, share, comment. If you want me to talk about anything new, put it in the comments. I'm happy to bring up more information and try and help more people as much as I can. And as always, follow along for that journey, follow, subscribe, whatever, and I look forward to you guys in the next one.